Hello and welcome back to Medical Compliance with Clarissa. I'm Clarissa Benfield, our Global Director and Business Line Leader for our Medical and Laboratory Business at Intertek. And today I am beyond thrilled to be joined by Curtis Riley, the head of our notified body. Hi, Curtis.
Hi, Clarissa. Pleasure to be here today.
Yes, so excited to have you. So excited to have you. So Curtis, as I mentioned, you're the head of our notified body, but maybe you can give everybody an introduction to yourself, how you got into the business and what you do for the notified body.
Certainly. Yes, so I'm Curtis Riley, the head of the notified body for IMNB, Intertek Medical Notified Body. I've been in the medical device regulatory industry for over 20 years now, almost by accident, falling into regulations and quality. I trained as an engineer originally, did a bit of science and healthcare before that in the ambulance service. So bringing the engineering and the medicine together, I found a role in regulated activities. So trained as a lead auditor, a file assessor, I was a cert manager, and then for the last few years I've been in the chair of head of notified bodies. So responsible for all of the certificates we issue globally around the Intertek family. Wherever you sit as a client, the assessment, the independent review decisions, and the certificate issuance happens from our Stockholm office, which is the head of the home of the notified body in Kista there.
Yeah, and of course, there's been no bigger topic than the MDR, no bigger topic than the notified bodies, and you've certainly been very busy over the last few years with the process of transitioning right to the notified body for MDR and doing all of those really exciting things. And today, I think we're going to talk a little bit about some of the updates, some of the things that we've seen as changes with the MDR, with some of the deadlines and things like that. So I know there's been a lot of talk over the last few years with these extension deadlines, legacy devices, moving the dates out until 2027, 2028. So can you maybe walk us through a little bit for those who might not fully understand what qualifies as a legacy device, and when we're talking about these extensions and utilizing the transition, how someone does that as a manufacturer?
Certainly, I think it's good to reflect on that. And you mentioned the many extensions to dates, and it's often difficult to keep up with what's gone on in recent years. So medical device regulation, we're all familiar, it got published some years ago. It was 2017, actually, so long ago now. We've been in this transitional period. So in 2017, the new MDR was published, and we know that was replacing the previous medical device directive. And due to delays, the number of notified bodies, the readiness of industry prepared to submit applications, COVID happening, there was a need to push out those dates. And you mentioned the most recent change, of course, that's the extension for legacy devices. So a legacy device would be described as something that was previously certified against the medical device directive at the time of the date of application for when the MDR came into force. So that was back in May 2021. So there was this transitional period where the MDD certificates were being valid, and any new devices being certified would certainly come under the MDR there. So because of those delays in industry, the readiness, COVID happening, it was clear that the pace of device certificates were not at the extent that would be required to ensure sufficient numbers of medical devices being on the market. So something had to change. So we saw an extension to that date of application, and now with some amending regulation, a further extension to 2027, as you say, and 2028. And it's the classification of the device that dictates what is that extension. So if you have an MDR certificate that is valid at the time of that implementing regulation, you can apply to a notified body through a self-declaration process and submit an application for MDR certification to prolong your MDD certificate. You mentioned the dates 2027, that's for the higher risk devices, so the class 3s. There's some 2B, the implantable type of products. These are the devices with the higher risk. And of course, we want to make sure that there's the highest level of conformity for those sooner. So those need to meet that 2027 date. So the end of the year, 31st of December. There was also a date in 2026. That was for the active implantable devices. That's actually outside of Intertek's scope, so none of our customers are thankfully affected by that. But if you do have those products, you can have an extension until 2026. And then 2028, the end of that year, is for everything else. It's the Class 2As, the Class 1s, and the exceptions of the Class 2Bs that were not under 2027.
Yeah.
A lot of dates there. So in short, a
Yes.
manufacturer needs to submit an application to a notified body for us to extend those dates. So working with us as a client of Intertek, you would fill out the change note request process form, informing us that you wish to prolong your legacy MDD certificate, and we'll work with you within 2 to 4 weeks to have that extended. And we're in the final period now. We're in this last month of time required to submit your application to the notified body. So by the 26th of May, we need to ensure that we've received those applications to prolong the MDD certificates, and then have the agreement, the contract signed by both the customer and us by the 26th of September. So a busy month ahead, and we're certainly seeing a number of those applications coming in. And great to see that from customers new to us from Intertek, coming in from some of the competition notified bodies, where we have capacity right now to onboard clients and to look after the surveillance activities for those MDD certificates. So yeah, the final countdown is underway.
Yeah, and I think you mentioned a couple of things here that are really important and quite interesting, right? The whole idea that these dates were extended again, right, because of taking this really, realistic look at where everybody was, right? Where the notified bodies were with getting people through the process, where manufacturers were. Obviously, the intention of the MDR is not to keep products from getting onto the market in Europe, right? I mean, they want to be moving things forward. And so I think understanding that these deadlines were extended to allow for manufacturers to have more time to work with the notified bodies and get their products through, I think is really important. The other thing you mentioned too, which, we want to make sure people always remember, is it's not just an automatic extension. You have to make sure that you're going through the process, right? They're not just automatically extended because you had a valid MDD certificate. You don't automatically get to utilize the extension process. You have to go through that application for the extension.
Absolutely right. So if a manufacturer wants to have the benefit of that extension period, it's to the end that there will be an MDR application for that, to ensure that the device is in conformity with the latest regulations. So a manufacturer must submit their application for the prolonging, on the understanding that we'll also be seeing that MDR application to ensure the safeguarding of products to market over that period.
Mm-hmm. So what about for those manufacturers that perhaps had an MDD or AIMD certificate that did expire and they didn't apply for the extension? Can you go back and apply? Like, how does that work if you already had a certificate that expired in the past?
I think one of the key dates there to answer that is the May 2023. So when the extending or the regulation was amended for this prolonged period. So if at that point in time, so your MDD certificate expired before May 2023, unfortunately, there's very little that can be done at this point. So you would need to submit an application to the MDR as soon as possible to reduce any gaps in certification. There would be no means.
And then if it's post that date, then you can go back and make some sort of application for the extension. Yeah.
Yes. So if the certificate was valid and an application is being made, we can certainly prolong it out to those extended dates.
So aside from, filling out the application information and going through that process, is there anything else that a manufacturer has to do to somehow prove that their device is a legacy device, or is there any other steps that someone needs to be aware of as they're going through this process or applying for the extension?
Certainly. So we're quite lucky that the guidance documents from the European Commission and the regulation, they're pretty clear in the steps that need to be taken, the declarations that the manufacturer needs to make. It's all about ensuring that their quality management system is in conformity with the MDR. So we can accept the manufacturer's self-declaration. And it's something that they must do. They must declare as part of this extension process that their quality management system is in conformity with the new regulation. I know that there's a template that's been made available. It was developed by the Medical Device Industry Association, some input from industry, the notified bodies, the competent authorities, and that's now available on the MedTech Europe website for that a declaration. And it's Well, it's basically a declaration for the validity of the certificates that were being issued under the directive and for the continued placing it onto the market. So we do have a framework in place. There is a template. It's common language that's been developed and accepted. So if they follow that guidance, that's will certainly put a tick in the box for the declaration that we need to see. But the self-declaration only goes so far, and manufacturers, they need to approach the notified body. We need to go for this extension period. So we are seeing manufacturers contacting us, wanting this extension, but importantly to receive from us the confirmation letter from the notified body, and that's confirming that we, as the MDR notified body, are taking responsibility for that continued surveillance of the legacy devices, performing all of the surveillance activities whilst they're undergoing their MDR application with us.
So it's really key, right? Waiting through that process and making sure you get that confirmation from the notified body.
Absolutely.
Yeah. The other question that people ask kind of as it relates to that, right, with devices that have been on the market or what would be considered a legacy device. Of course, we know in the medical industry, people are continually making changes to their products, update to their products, technology is changing. So are there changes you can or can't make to a device that would still allow it to be considered a legacy device or still allow you to rely on that MDD certificate? Or, you know, are there specific guidelines that someone has to follow in terms of what they can or can't change?
Great question. It's one of the key areas for this extended duration until 27 and 28 is that significant change is not permitted. So if you're needing to make some fundamental design or intended use changes, you would have to resubmit your technical file for an application for the MDR. So there is a guidance document for that. It's the MDCG from 2020-3, so 2020-3. And this links very nicely to within the MDR, Article 120, and that refers to those transitional requirements and our new amending regulation. So the three documents together really carefully specify the significant change is not permitted. But if you strip all that back, the regulation, that MDCG document, it has some fantastic flow diagrams in the back annex, and it's really helpful for manufacturers and us in the notified bodies to determine is the change significant. And there's 3 or 4 flow diagrams in there. The first one is looking at intended use of the device. So if you're modifying thinking aloud here, something like the user population or clinical conditions, that would be a significant change to the intended use. Then there's design. Design is continuous, and manufacturers always have to change their design based upon the availability of components, changes in state-of-the-art technologies, and their own supply chain. They're forced to maintain a design file. So we know that design change is continuous, and there's again another fantastic flow diagram that talks about the extent of change you're making. If it requires further clinical data to support the safety and performance of the device, that would be considered significant. Also, if we think about the risk management process, if you're changing the design to the extent that it will implement new risks or the existing risks have a negative effect, that would also be considered significant. If I think about the latter flow diagrams, there's a really helpful one for software. It talks about, again, changes to the intended use. If you're changing the architecture of software, or if you change what would be inputted by a user and you change it for a closed loop algorithm, those would all be significant. And then lastly, there's 2 other flow diagrams around material changes. So if you have to change enclosure materials or parts that are in contact with the patient, thinking about the biocompatibility of components, and then the sterilization processes as well. So I think stripping all of this back, if you are making a change, follow the flow diagrams in the MDCG, but also get in contact with the notified body as soon as possible. Before making the change, you need to inform the notified body so we can determine is it significant or not, what the implications of that are. So stay in contact, keep the dialogue open, and we'll help with that process to determine if it's significant or not.
Yeah, and I think too, it just again highlights that, you know, these extensions that have been allowed, it's not just a catch-all, right? It's not just to allow you to continue to use the MDD and use your CE mark and just keep making changes to your product, right? It really is to allow for this, time for both the notified bodies and the manufacturers to work together, right? As you say, really being in contact with each other, collaborating with each other during these next couple of years while things are, settling back out in terms of capacity of all the notified bodies and getting manufacturers through.
Mm-hmm.
Yeah. So the other question that sometimes comes up too is, what if I'm a manufacturer who is planning to make my product obsolete? I just want to use the extension to continue to mark under the MDD, but I have no intention of taking a specific product to the MDR at any point. I just want to use the next 3 years to continue to market my product in Europe. And then when I hit the deadline, I want to take it off the market. Is that something that's allowed?
It's not. That's, as you've just described, the intent of this extension was to proactively encourage the transition to the MDR to facilitate that state-of-the-art regulatory framework within Europe here. So one could make an application, but that is in the knowledge that you're also applying for an MDR assessment at the same time. So you would be planned into the system to submit your technical file, to undergo the full stage 1, stage 2 audits to achieve MDR certification. So if you are having this extension, you would need to be prepared to undergo the MDR conformity assessment.
Heading through until 2027 or 2020. Yeah, I think, another kind of interesting thing that we've seen, of course, with the MDR, right? We saw some products that were being classified differently or had a change in classification. Some people suffered what they would call like an up classification, right? So something that maybe was a lower classification and now is taken to a higher risk level. So how do people handle that situation, right? If you were one classification, you had a certificate that expired, or you're moving to a new classification, what's the best process for someone? How do they kind of catch up or approach in this type of situation?
Great. It's actually just the same. So if you have had an up classification of your device, you are still eligible for that extension under the increased classification. So follow the same process, fill out the change note application form. We'll go through the assessment to prolong the certification. So if we are seeing any increase of classification, you fill into the same bucket of process. So we can handle that just the same way.
Perfect. And then, I think we talked about it a little bit kind of at the beginning. You noted it, you mentioned it, right? Just with notified body capacity and demand. And are there things, obviously you're very closely involved day in and day out with our notified body and with the industry and with what's going on with the other notified bodies, kind of from an insider perspective, from your point of view, what are we seeing in terms of demand now that we're getting really close to this May deadline that we talked about, right? The May deadline to select a notified body, and then coming up on the September deadline to sign your contracts.
Yeah, I think the extension certainly did allow manufacturers to take a breath, or the perception that they could, to slow their application. And we did say that initially, but now as we've head towards this May important date in September, and because of the tight controls around significant change, we're still seeing a very strong demand for our services. I think in part, and without doing too much of a sales pitch, it's where we at Intertek do have that very broad scope of accreditations. If you think that we're talking about the EU MDR here, we also have the EN and the ISO 13485s. And with that, the Medical Device Single Audit Program, the NDSAP program. And last year, of course, we gained our accreditation for the UK CA services under the UK MDR. That's a really powerful position that we can, through one audit, be able to offer all of those certificates and certifications. So we've seen a good demand, and that remains a constant. But we've, as you know, we've internally built for growth. We've increased our file assessors, the number of clinicians and auditors around the world, to make sure that we can now act during this high peak of demand. So absolutely, we're nicely busy, but certainly we have capacity as planned to take on more clients. So there was some hesitation, I'd say, from the industry at the beginning, but now broadly, manufacturers are recognizing the need for the transition. They're hearing that here we do have capacity, so we're seeing a good flow of client requests and onboarding new customers to us that we didn't have previously under the MTDs. That's fantastic to see.
Yeah, and I think too, one of the interesting things just to look at is if you kind of review the data overall, which has been made, quite public, which is interesting to see, right? We know that there was, 20,000 MDD certificates that were out there, and now we've seen, 18,000 MDR applications overall, right? And they think they've said they've cleared something across the notified bodies, like 5,500, 6,000, right? So we're only about 25% of the way through of all of these manufacturers who need to go through the extension, right? Or who need to bring their products up to the MDR, right? Same on the IVD side, right? Obviously on a much smaller scale, but in no way through everybody who needs to get through the process. So what do we think this means like throughout these next couple of years then, right? So if we still have all of these people who still need to get through the process, if we're only at, 25% or, 20% on the IVD side for some, like what is this meaning for us as an industry as we look at, kind of what these numbers are now versus where it needs to be by 2028?
I think there's still a large concern from all parties, from the competent authorities, the notified bodies, the manufacturers, for the capacity in the industry to recertify these devices. The numbers you quote are quite broadly correct, and there were 20,000, 25,000, including the active implantable directive as well. So we are seeing a good pace of applications to be able to meet those deadlines. I know that there's been a Q&A from Team NB and the European Commission asking around the progress of the number of applications, and all notified bodies did respond to that. We've only had data most recently from October, and we're looking forward to the next report to see how we're closing the gap there. Broadly, I believe the notified bodies feel we are now making a good pace towards those extended deadlines. But this is only going to work if we have compliant technical files that the manufacturers are prepared, they're submitting on time and responding to the conformity assessment. Otherwise, there is going to be a risk of shortages of devices over the coming years, and that's what these extensions were for, to safeguard the market, to prevent the risk of a shortage. When you were saying that, I was just thinking about the MDCG document 2022-11 that keeps being amended. And this one here talks about those transitional arrangements and ensuring that the notified bodies are doing everything they can to help and support without consulting the manufacturers through the process, through the pre-application process, through the application process, making sure that we're streamlining our certification activities, that we're being open and transparent, helping our clients with as much guidance as we can to hold their hand to the point of explaining the process, again, without consulting, to be more approachable and open to explain how this will be. So to see such a guidance document come out to encourage the notified bodies to proactively work with the manufacturers to help them through the process is a very positive step to make sure that we're doing all we can to safeguard that transition.
Yeah, I think all of that is really worth noting, right? Just the collaboration across the notified body and industry, as you say, like the collection of all the information, the making the data public, the wanting to be sure that the notified bodies are moving forward at pace, right? Wanting to understand how the industry is moving, right? There is a lot of that move towards kind of industry collaboration to make sure, again, that this is a process that's moving towards, getting all of these fantastic medical products onto the market in Europe, towards having new and innovative products on the market in Europe, right? It's not intended in any way to slow things down. And really, you see that via all of this collaboration and the working together to say, hey, what's the progress that's being made? How much more progress do we need to make? How are we doing going throughout this process as an industry and a group, right? It's not just single notified bodies working independently, right? Everyone's working together. So I think it's really positive.
That's right, and the number of notified bodies is increasing. I see broadly that notified bodies have a much more specific and narrow scope than they did in the past, perhaps under the previous MDD, and there's been some new players coming to the market as well, people that were not previously operating under the old directives, supporting the industry now, again, with more specific and narrow scope. So, it's never great to see the competition increasing, but it does mean that the framework is working, that there is more availability of notified bodies, that if we want to ensure this for everyone to have their products coming to the market, that there is the framework there to service them and get those certificates issued on time.
And you did sneak it in there, and I want to make sure we highlight that again too, right? Some of the things that manufacturers can make sure that they're doing to help the process go faster, right? So you say, of course, we have to have full and complete technical files, but are there other things that we would say, as someone is preparing all of their information, to make the process go as smoothly as possible?
There is. It comes down to that, the application. And we on our website, we've issued a guidance document. It follows the MDCG guidance on how to structure and format your technical file. Again, being careful not to consult, but we're very clear to manufacturers as to what should be in their technical file, the flow, the structure, the formatting, and a list of documents that would be included in the different sections. And that maps against our conformity assessment, how we perform our review. So if you follow that structure, of course, it'll make the risk of receiving non-conformities less. You'll be submitting documents that you know we need, and hopefully if you've understood the intent of the questions and the inclusion of those documents, it'll facilitate a much smoother review. I think that's the main thing.
Yeah, I think it's really important for people to remember all of those things, and again, to reach out to the notified bodies, right? If you have your notified body selected, or if you're looking for a notified body, now is the key crucial crunch time, right, before these upcoming deadlines. Do you want to repeat the deadlines just one more time, and emphasize those two dates so everybody remembers, with the May deadline and the September deadline?
Certainly. So before May 26th this year, so in the coming weeks, we need to ensure that you submit your application to the notified body to have the prolonged extension for your legacy devices. And then by the 26th of September this year, you need to have signed the agreement, the contract with the notified body to allow us to extend into those latter dates. And then that's 2027, December 31st for the higher risk devices, the class 3, the 2B implantables. And then you've got until 31st of December 2028 for the other devices. So the class 2Bs, which are not on the exceptions list, the 2As, and the class 1S.
And, not that we have a crystal ball or a magic 8 ball, and no one would hold you to it, but, I know there's been some rumblings saying, oh, do we think the deadlines will get pushed again? Do we think there'll be further extensions? I mean, it seems like from all of the communication that's coming out that, they really do want to hold firm to these deadlines of 2027 and 2028. Are you feeling that same way with all of the information that you're hearing?
That's right. I think together, the industry as a whole, so the member states, the notified bodies, the competent authorities, industry, we want to ensure that we're not seeing any further extensions. And I can't imagine that would be the case. We have amended the regulation, or we've seen the amended regulation, I should say, requiring these full and final steps to ensure that we meet them. And I think that this extension, it has really brought the industry together. It has made a stronger collaboration between all of those parties for the implementation of this MDR.
Yeah. Absolutely. I couldn't agree more. Well, Curtis, this was such a great conversation. I'm sure we'll have lots more information in the coming months and coming years as we continue through this transitional period. If anyone has any questions, of course, they can reach out to me directly. I'm happy to connect you with Curtis as well as the notified body. Really appreciate you joining us today to talk about all things MDR and the MDR extension. Thanks, Curtis.
You're very welcome.